This things for the IMS College has been invited for me. So thank you for that. So today, what we'll be discussing about the medical nutrition therapy for this post-COVID session, because we all know what will happen in 2020 and 2021 and also a part of 2022. That COVID was some kind of pandemic. It was pandemic. The treatment was there, but novel coronavirus is something was very horrendous. It's this situations is very ocean to ocean, and we're having so much of adverse situations coming up after the COVID and the COVID situation. So in that cases, we need to correct ourselves regarding so many things, because after COVID there must be some like chest infection, their diabetes will be there, the obesity will be there, and also the mental health. Because mental health is very important that we too need to care of, because during the COVID, that time was lot of television channels used to come to us regarding lot of things about what is the consequences of these strain, those strain and that strain. But that time we spoke what about the mental health, because mental health is so important, because children, they used to go to school, they are not staying at the home only for the online classes. So what could be the effect of the mental health? That is the very important key features that we need to discuss. So can you please get this slide changer? Yeah. So in that case, so we all know this is novel coronavirus, because coronavirus was novel because it was very unknown to all of us. That was, he said, novel, and SARI and SARS is so common because any severe acute respiratory syndrome or infection was used to be SARI. So we all know that COVID basically is a coronavirus which was affecting our lungs. So lungs was very much affected, and lot of hospitalization cases, lot of ICU cases, and lot of infection cases was there. So we'll discuss about regarding these things. So there is, what are the complications of the post-COVID-19? The complications, there are chronic complications like the ageusia, there are complications like there are dysgeusia, anosmia, and also there is sarcopenia, loss of muscle. Because still now, because I am in KBC Medical College Hospital, still now there are lot of patients used to come to us that they have problem like gastrointestinal problem. Previously, prior to COVID, he could tolerate or she could tolerate wheat, she could tolerate milk and all those things. But now he or she is not tolerating milk, not tolerating wheat, or not any kind of resistance stuff. This is due to they had some COVID infection, and that is the side effect or adverse event, the consequences they are getting up. So there are a lot of post-COVID-19 complications that we are dealing with right now. And there are drugs also there. There are a lot of drugs during the COVID. Those time, because doctor that time also they are researching what kind of drug would be beneficial for us. I think you all must have aware of different television. There one is the antiviral drug, that is remdesivir. What it is not finding, it is not unavailable. Oxygen is not available, unavailable. Lot of things was happening on that time. So what are the effects and adverse events of this drug? Because there are because nowadays also we used to see there are people like OTC, they used to go to any pharmacy shop and taking azithromycin, lot of antibiotics without asking any physician, without asking any prescription. That is not true, because lot of antibiotics, lot of any kind of drug have lot of adverse events or adverse side effects. So they have some nausea problem, vomiting problem, abdominal pain, and also they can lead to the non-alcoholic steatohepatitis. That the hepatic problem can be come up. And also there is some steroid during COVID that we have seen that doctor used to give some steroid to on a particular cases, that Y-solone, prednisolone. The patient was not diabetic, but after having the steroid, the patient got diabetic, because any kind of steroid used to go for treat for the autoimmune disease, any autoimmune disease. But why? Because our insulin basically secreted from the beta cell, from the pancreas, and liver is also very much important organ. Because from the liver we know, those who are from the biochemistry department, I don't know, they are from biochemistry or other department, they don't know the glucogenolysis, the new glucogenesis, all the cycles that basically happened in the liver, and this both biochemical process, the glucogenolysis and the new glucogenesis, they're actually controlling the blood sugar. So if glucogenolysis hampered, if glucose production is it's not coming from the liver due to the steroid, what will happen? Diabetes will not control. If diabetes will not control, then it will be problematic for the too much of hyperglycemia that can even go for macrovascular, microvascular disease like diabetes cardiomyopathy, diabetes retinopathy, diabetes nephropathy, or other problem will occur. So steroid plays an important role to do some immediate treatment, but after the steroid, there are a lot of side effects can come up. So that was the side effect that all the medicine that time during the COVID period of time, maybe there was the first class or first line of treatment, but after that there are a lot of complications, and the acute and chronic complications can come. So need for these interventions of the COVID-19, their recovery might be persistent functional impairment, fatigue, muscle weakness. Because any clinical dietetics, because in our hospital also, we used to go for the first the measurement, the assessment. There are a lot of assessment tools. These tools basically we used to follow in our hospital. The MAS tool. MAS tool we can see when a patient is being admitted in our hospital. This is the MAS tool, and the ABCT method. What are the ABCT method? A for the anthropometric measurements like their height, weight, BMI, their medium circumference, all the things we can go for the A. The second thing is the biochemistry. We need to check the biochemistry, like what is the potassium, what is the albumin level, what is the blood sugar level, what about the HbA1c. Patient is a frank diabetic patient or patient is a normal diabetic patient. What kind of hypertensive patient is? What kind of medications are going on? There are a lot of medication. In hypertension, there are AC inhibitors, there are ARB, there are beta blocker. All the medications are going on. So what would be the drug-nutrient interaction can happen? We can see through this assessment, and also the food allergy, food intolerances, and also we can look at the sleep analysis test and the sleep study test. We can follow with the self questionnaire. So all these tools are so important when a patient comes to our hospital, and we used to treat with the same tool following the proper guideline of a clinical dietetics. Now the main target, what will be the nutrition intervention of a patient or guideline of this COVID-19? The improve immune response, because immunity is very important. IL-6, interleukin, all the cytokines, where we can talk about vitamin C, because during COVID also, most of you see me or other doctors were there, then we can see a lot of vitamin C, ascorbic acid rich food, lot of modulatory food, lot of antioxidant. We spoke about nasoneem, we spoke about lycopene, we spoke about gingerol, we spoke about catechin, we spoke about isoflavones, lot of antioxidant used to spoke, because nowadays আজকাল সবার টেন্ডেন্সি হচ্ছে যে বেশি ফ্রাইড খাবার দাবার খাওয়া, খুব ডিপ ফ্রাইড খাবার দাবার খাওয়া with lot of oils. Lot of restaurants are there, lot of outside foods are there, but once you do the deep fry of any particular stuff, you will not get the adequate nutrients that you have wished for. The nutrients will lose and the free radical will make. The free radicals, when the free radical will come up, they are complementary, habitat to have some kind of, non-communicable diseases like diabetes, cardiovascular problem, maybe any malignancy, maybe any infection. Lot of problem can come out. Garlic is good. Garlic contain allyl sulfide, so the very good amount of antioxidant is there. But if you talk about garlic chicken, if you talk about too much of garlic with a lot of deep fried, প্রচুর তেল দিয়ে ভাজি, that will not get that adequate amount of antioxidant we have wished for. So in that cases, cooking mechanism are very important, because lot of aldehydes will destroy the important nutrients, the flavonoids and antioxidant we used to get. If I talk about tea, আমরা tea থেকে জানি প্রচুর সেখান থেকে antioxidant থাকে, lot of phytochemicals we used to get. If you talk about green tea, we can get the epigalactocatechin gallate. So, but if you take the tea with lot of milk, with lot of sugar, with lot of temperature, in a high temperature, you will avoid to get all the important antioxidant and nutrients. Rather, you will get the toxic items from the tea. So, Malai cha will not get the tea. We are actually thinking about the antioxidant flavonoids. We are actually getting the tea. So, the basic compositions of the tea will we can't retain. They will detain, and we can retain all the tannic acid and all the adverse events from the tea we used to get. So cooking mechanisms are very important. In that cases, lot of food groups are written over here. But if you take the food groups on the broiling, simmering, boiling, that will be much more beneficial, and that will be the onus for us to maintain the proper, because high temperature, too much of frying temperature is not at all suggested from the dietetics department or from any clinical dietitian, because that will destroy and that will not give the adequate amount of nutrients that we have wished for. So lifestyle factors affecting the inflammation. That is very important, the gut microbiota. The gut microbiota is very important nowadays. Lot of patients used to come to us, amar prochur acidity hoche. We have lot of acidity, we have gastroesophageal reflux, maybe we have some abdominal pain, we can't digest dal, we can't digest wheat products, we can digest milk products and all. So in that cases, what would be the main solution for the gastrointestinal problem? The low FODMAP diet is being suggested for. Low FODMAP diet means they're basically the low level of these oligosaccharides and other. Maybe you might have seen, if you take the ghugni, normal ghugni chana, cowpea, chickpea, kapri chana, maybe after having all those things, you may be some gastric pain or maybe some abdominal pain. But once you make it sprouted, like germinated or onkurito chola, onkurito move, that will destroy the oligosaccharide, lowering level of the oligosaccharide, enhance the protein percentage, vitamin C percentage, and good for the digestion. So there is a few methods if you can apply to our normal daily food groups, that will be really good for our health and also the gut microbiota. Because symbiotics is very important, that is combinations of the probiotic and the prebiotic. We all know dog doi, basically curd, the sour curd. From the sour curd, we'll get very good bacteria like bifidobacterium, lactobacillus. We get good amount of the probiotics, and in our large intestine with the colonic bacterial epithelium, there we can get the fructooligosaccharides, give good amount of the prebiotics. So prebiotic, probiotic, and symbiotics are very good for our health. If you see, maybe one doctor prescribes to you any penicillin group of antibiotic like amoxicillin or maybe 2 antibiotic kind of thing. So after ended up with the antibiotic course, you are having some diarrhea, dysentery, all this problem, because antibiotic doesn't know which are the good bacteria and which are the bad bacteria. They will kill all the beneficial bacteria, and patient ended up with the gastrointestinal problem. So if you take with the antibiotic, that any good probiotic like curd or any now a lot of probiotic nutraceuticals are available, with discussing with your dietitian, clinical dietitian, you can try to consume of this probiotic and prebiotic. That is very important for us. Dietary approaches to addressing this immunoinflammation, because our main topic will be the mental health. So mental health, when the mental health is come up, so you people are so disappointed why I'm saying so much of these things also, because mental health is very important. You can see nowadays lot of patients are used to go to a psychologist, clinical psychologist, maybe going to a clinical psychiatrist and all the people, and there are a lot of drugs also available. You must have heard the SSRI, selective serotonin reuptake inhibitor, maybe MAO inhibitor, for lowering the depression. But from the food you will get adequate amount of the anti-depression food, because serotonin is very important in our brain, because a lot of neurons are basically taking up the serotonin. So our brain is losing the serotonin. For the serotonin, if we try to find some kind of good amount of serotonin rich food, tryptophan is very good amino acid. Like you can get from egg we'll get good amount of tryptophan, from omega-3 fatty acids like ilish mach, hilsha, and lot of big fishes we can get adequate omega-3 fatty acid. We can get tryptophan from egg also, from boiled egg also. So tryptophan can help to reach the blood-brain barrier to give a good amount of serotonin. So from that diet, chocolate, maybe there's some advertisement is there. One lady is dancing and used to film, and someone is giving a chocolate, then lady again come up and start the dancing. So chocolate is a very good source of the tryptophan, serotonin, and that will be a good mood factor. So good mood is always be there. So good mood should be there. In that cases, we can have lot of vitamin C rich food, vitamin E rich food, carotenoids, zinc, magnesium, omega-3 fatty acid. We try to cut down the saturated rich food. Saturated fatty acid rich food means too much of ghee, too much of vanaspati, too much of cheese, too much of butter shouldn't be there. We try to restrict at least less than 7%. We try to include mustard oil, try to include canola oil in our daily diet, 10 to 15%, and also the rice bran oil should be there less than 10%. Combination of oil is good for cooking. My suggestions to all of you, don't go for any advertisement gimmick. There are a lot of advertisement companies are showing this oil is cholesterol free. This oil is cholesterol free. I think they are not saying any kind of false statement. But neither any kind of vegetable oil sources doesn't have cholesterol. Vegetable oil sources only have the plant sterol or ergosterol. Cholesterol only you can find from the animal's body, not the vegetable's body. So the statement was not false, but they are showing that my oil or my branded oil should be exclusive than other oil. So you should be, keep your eyes on, keep your ears on. Don't go for advertisement gimmick. Once you purchase any kind of food groups from the outside market, try to flip up and read the nutritive value. What kind of nutritive value is there? If trans fat is there, don't go for the trans fat. Try to avoid these carbonated beverages. That particular acid is there. Those acid is used for the bathroom cleaning. So don't go any cold drinks, aerated drinks. Once in a blue moon is okay, but don't make it a habit. So it will be again give you an adverse effect to your overall health. So that is very important. Include lot of good nutrients in your diet, not the bad nutrients or the adverse nutrients. Tea, packed food is not necessary, because a few months back I was at a conference in the budget-friendly food. Food doesn't mean that you have to take a lot of money in your pocket. It doesn't mean that. We shouldn't have like blackberry, blueberry, cranberry and all those things. যেটা আমাদের বাংলাতে পাওয়া যাচ্ছে like পেয়ারা, like পেঁপে, আমরা সেটাই খাবো। পয়সা খরচ করে অত দামি খাওয়ার কোনো দরকার নেই, because the imported fruits, the amount of the nutrients we can get from the local fruits, this particular amount of nutrients will not get the imported fruits. So you always try to emphasize, try to consume the local branded fruits, vegetables, and local branded different foods. It's not like the imported costly. Spaghetti, lot of quinoa, lot of muesli. It doesn't mean ki amra khoi, doi, bhat, macheর ঝোল এগুলো ভুলে যাবো. So we always emphasize the local Bengali food that can get the adequate amount of nutrients, and we can try to keep our Bengal farmers to live. আমরা তাদেরকে বাঁচতে সাহায্য করব if we purchase from their crops. So always I discuss about the nutrients and also the gut microbiota. There are also other terms called resistant carbohydrate or resistant starch. So resistant starch, basically there's a good amount of the dietary fiber. The role of dietary fiber goes in our dietetics field, because 40 gram of dietary fiber, soluble and insoluble, we used to take on daily basis. And the resistant starch is also a dietary fiber. Resistant starch doesn't walk in our small intestine, they directly goes to our large intestine. From there, they are taking lot of colonic epithelium and ended up with the short chain fatty acid butyrate, and they are acting as a fructooligosaccharides. It's good for our health, but some people doesn't digest resistant starch overnight or dinner. So resistant starch like dal, soybean, all are good, but try to avoid in dinner. Dal is okay in the lunchtime, soybean is okay during the lunchtime or the breakfast, so a sandwich will be okay, but try to avoid resistance diet as much as possible during dinner. And this is the recommendation, because water should be there liberally, because we maybe we are in the air condition, we are not perspiring, but we have some insensible perspiration is there. So we try to maintain the water intake at least hourly, 250 ml of water, and also we try to maintain our respiratory quotient. Our respiratory quotient means respiratory quotient from carbohydrate is 1, respiratory quotient from protein 0.8, and respiratory quotient from fat is 0.7. So in that cases we try to maintain our respiratory quotient. In that cases our platter should be a balanced diet. Half of the portion should be protein, 1/3 will be the like 1/3. If you take a one plate, then half of the portion is protein, 1/3 will be the carbohydrate, and 1/3 will be the fat kind of food, and so the fiber will be there. So in that cases we try to maintain our RQ level, and lot of important flavonoids and the antioxidants are daily. Like tomato gives a good antioxidant lycopene, brinjal gives a good antioxidant niacin, soybean gives a good antioxidant like isoflavone, green tea gives a good antioxidants like epicatechin gallate. So we try to include all the food groups and try to avoid the coloring foods. Like lot of color, you doesn't know the color is maybe vitamin yellow. Like we are taking a 10 টাকার বিরিয়ানি or 20 টাকার বিরিয়ানি, সবচেয়ে খুব সস্তায় হয়তো খাবারটা দিচ্ছে, but it means combination with the vitamin yellow, and vitamin yellow is just like a color of the saffron. Saffron is a permitted color, it's too costly, and vitamin yellow is a non-permitted color that can end it up with a lot of malignancy problem, lot of problem with the infertility, and lot of problem with the also a pregnant lady can be discouraged due to the use of the vitamin yellow. So try to avoid lot of non-permitted color cultivated. So the summary is the patients with the COVID-19 should be supported properly with the physical and the mental complications would be there. So we can make a proper dietary guidelines with the mental health should be there. Patients should be advised to have the different seasonal food with different cultural food also, and also the anti-inflammatory and also the anti-immuno stimulating activities, and supplements or nutraceuticals are different where are available. If the clinical dietitian will prescribe different clinical food to bridge the gap between any kind of local food and also their food they are intaking, that should be properly emphasized. And also don't go for any kind of pharmacy shop by your own choice and over the counter medication. You always ask to your respective physician and always talk to your respective dietitian before purchasing any clinical food. So that should be a proper teamwork, a physician, a clinical dietitian, a clinical psychologist, physiotherapist, and also all the allied healthcare professionals. So that should be united together, that they will be treat and to teach and to counsel to a patient very well, very rapidly, and keeps instead of saying no kind of thing, we have to be very active listener, and we try to combat accordingly, because we have to be very empathic. We have to be very empathetic in front of a patient, and we have to talk together with them. So thank you so much for your kind audiences, and thank you so much for inviting me, Principal Adam and IQAC and IMS, for this conversation. Thank you so much.